Raise your hand if you've ever experienced shoulder pain. If you're watching this, chances are pretty good your hand is up, or maybe you're even trying to raise it and finding it doesn't quite want to cooperate. You're not alone. Shoulder pain is incredibly common, affecting millions of people every year. In fact, studies show that up to 26% of adults experience shoulder pain at any given time. Now, before you reach for the pain relievers, what if I told you there are effective ways to ease that ache without medication? Many people are actively seeking natural, non-invasive approaches to managing pain. And that's exactly what we're going to explore today. We will delve into proven techniques and lifestyle adjustments that can help you find relief and reclaim pain-free movement. So, now that we know we're in good company with our achy shoulders, let's talk about what might be causing that discomfort. Shoulder pain isn't a disease in itself, but rather a symptom of an underlying issue. Some of the most common culprits include rotator cuff problems. Think of those tendons as the cables that keep your shoulder joint stable, and they can get strained or torn. Arthritis, both osteoarthritis and rheumatoid arthritis, can also lead to inflammation and pain within the joint. Bursitis, and inflammation of the fluid-filled sacs that cushion your joints, is another possibility. And, of course, direct injuries from falls, sports, or accidents are frequent causes. It's really important to understand that while we're discussing general solutions today, accurate diagnosis from a medical professional is key to truly addressing your specific pain. Okay, so you've hopefully got a better understanding of what might be going on in your shoulder. Now, let's talk about something you have a lot of control over: your posture. You might be surprised, but slouching and hunching can wreak havoc on your shoulders. Think about it. When you're slumped over, your shoulder muscles are constantly working overtime to compensate, leading to strain and pain. Let's start with your desk setup. Is your monitor at eye level? Are your shoulders relaxed, not shrugged up towards your ears? Make sure your chair provides adequate back support. And what about your sleeping position? Avoid sleeping on your stomach, as this can force your shoulder into an unnatural position. Try sleeping on your back or side with a pillow supporting your neck and shoulder. Small adjustments can make a huge difference. Alright, let's get moving. Gentle stretching is crucial for improving shoulder mobility and reducing that stiffness that can really set in. We're going to look at a few key stretches. First, the cross-body arm stretch. Gently bring one arm across your body, using your other arm to support it, and feel the stretch in your shoulder. Hold for about 20 to 30 seconds. Next, the pendulum stretch. Lean forward, letting your affected arm hang down, and gently swing it in small circles. And finally, the doorway stretch. Place your forearms on a doorway and gently lean forward until you feel a stretch in your chest and shoulders. Important. Listen to your body. These stretches should feel gentle, not painful. Overdoing it can actually worsen your pain, so start slowly and gradually increase the intensity as your shoulder becomes more flexible. Now that we've loosened things up with stretching, let's build some strength. Strengthening exercises are essential for stabilizing the shoulder joint and preventing future pain flare-ups. We'll focus on exercises that are gentle yet effective. Isometric exercises are a great starting point. These involve contracting your muscles without actually moving your joint. For example, you can press your palm against a wall and hold for a few seconds. Resistance band exercises are also fantastic. Try external rotations. Holding a resistance band, keep your elbows close to your body and rotate your forearms outwards. Again, proper form is absolutely crucial to avoid injury. If you're unsure about your form, consider consulting a physical therapist for guidance. Let's move on to a classic pain relief duo: heat and cold therapy. But knowing when to use which is key. Cold therapy is best for acute injuries or flare-ups, as it helps reduce inflammation. Apply an ice pack wrapped in a towel for 15 to 20 minutes at a time, several times a day. Heat, on the other hand, is better for chronic pain or stiffness. It helps to relax muscles and improve blood flow. You can use a heating pad, a warm compress, or even a warm shower. Again, limit application to 15 to 20 minutes. Be careful not to burn yourself with either heat or cold. Always use a barrier between your skin and the pack, and monitor your skin for any adverse reactions. Now let's get hands-on with some self-massage techniques. Often, shoulder pain is linked to trigger points, those tender knots in your muscles. A common spot is in the upper trapezius, the muscle that runs from your neck to your shoulder. Use your opposite hand to gently knead and massage this area, applying firm but comfortable pressure. Another common spot is along the shoulder blade, near the armpit. You can use a tennis ball against a wall to target this area. Slowly roll the ball around, searching for tender spots, and hold pressure on those spots for 20 to 30 seconds. Remember to breathe deeply and relax while you're massaging. If the pain is too intense, ease up on the pressure. Now, let's consider how your daily activities might be contributing to your shoulder pain. Are there specific activities that consistently trigger your pain? It could be anything from lifting heavy objects to playing certain sports. If lifting is a problem, focus on using proper form. Bend your knees, keep your back straight, and hold the object close to your body. Avoid twisting while lifting. For sports, consider modifications. If tennis aggravates your shoulder, perhaps try a lighter racket or modify your swing. Swimming might be a better option than overhead throwing activities. Identifying and modifying these pain-inducing activities can significantly reduce stress on your shoulder and promote healing. Sometimes, temporarily avoiding the activity altogether is the best course of action. We've talked about what to do to ease your shoulder pain, but now let's talk about what not to do. Overdo it. Rest and recovery are absolutely crucial for healing and preventing overuse injuries. Your body needs time to repair itself. Think of it like this. You wouldn't run a marathon without proper training and recovery, and the same principle applies to your shoulder. Adequate sleep is essential. Aim for 7 to 9 hours of quality sleep each night. Listen to your body's signals. If your shoulder is aching, don't push through the pain. Take a break. Schedule rest days into your workout routine. Ignoring pain signals can lead to chronic problems and significantly delay your recovery. While we're focusing on non-medicinal solutions, it's absolutely crucial to know when professional help is necessary. Don't hesitate to see a doctor if you experience any of the following: severe pain that doesn't improve with home care, numbness or tingling in your arm or hand, significant weakness in your shoulder or arm, a limited range of motion that prevents you from performing daily activities, or pain that occurs after an injury, such as a fall. These symptoms could indicate a more serious underlying condition that requires medical intervention. Early diagnosis and treatment can prevent long-term complications and improve your chances of a full recovery. It's always better to err on the side of caution when it comes to your health. Beyond the self-care strategies we've discussed, there are several alternative therapies that some people find helpful for shoulder pain. Acupuncture, for example, involves inserting thin needles into specific points on the body to stimulate healing and reduce pain. Chiropractic care focuses on spinal alignment and can help improve nerve function and reduce muscle tension. Physical therapy involves a tailored exercise program designed to improve strength, flexibility, and range of motion. While these therapies can be beneficial, it's important to remember that their effectiveness can vary from person to person. It's always a good idea to discuss these options with your doctor or a qualified healthcare professional to determine if they're right for you and your specific condition. So, how do you keep your shoulders healthy in the long run? It's all about incorporating the strategies we've discussed into your daily life. Prioritize good posture, both at your desk and during other activities. Regularly perform gentle stretching and strengthening exercises to maintain shoulder mobility and stability. Be mindful of your lifting techniques and modify activities that exacerbate your pain. Get adequate rest and listen to your body's signals. Manage your stress levels, as stress can contribute to muscle tension. And finally, maintain a healthy weight, as excess weight can put additional strain on your joints. These long-term prevention strategies can help you avoid future pain episodes and enjoy a more active, pain-free life. Let's clear up some common misconceptions about shoulder pain. Point 1 myth is that you should always push through the pain. This is absolutely false. Ignoring pain can worsen your condition. Another myth is that rest is always the best solution. While rest is important, prolonged inactivity can lead to stiffness and weakness. Gentle movement and targeted exercises are often more beneficial. Some people believe that shoulder pain is just a sign of aging and that nothing can be done about it. This is also untrue. Many effective treatments, both medicinal and non-medicinal, are available to manage and alleviate shoulder pain at any age. Finally, some think that if they aren't an athlete, they can't get a rotator cuff injury. Rotator cuff injuries can happen to anyone regardless of activity level. Now, let's hear from people who have actually walked this path and found success in managing their shoulder pain without relying solely on medication. Take Sarah, for example. She developed chronic shoulder pain after a car accident. Instead of immediately opting for painkillers, she worked with a physical therapist to develop a stretching and strengthening program. She also focused on improving her posture and incorporating self-massage techniques. Within a few months, her pain significantly decreased and she was able to return to her active lifestyle. Then there's Mark, who had rotator cuff tendinitis. He modified his tennis swing, incorporated regular stretching, and used ice after playing. He was able to continue playing tennis without the need for pain medication or surgery. These stories demonstrate that with dedication and the right approach, you can find relief and reclaim your life from shoulder pain. Okay, let's put some of this knowledge into practice. I'm going to demonstrate a few of the exercises and techniques we've talked about. First, the doorway stretch. Stand in a doorway, place your forearms on the frame, and gently lean forward until you feel a stretch in your chest and front of your shoulders. Hold for 20 to 30 seconds. Next, let's try the resistance band external rotation. Hold a resistance band with your elbows bent at 90 degrees and close to your sides. Slowly rotate your forearms outwards, keeping your elbows stable. Focus on squeezing your shoulder blades together to do 10 to 15 repetitions. And finally, let's do a self-massage of the upper trapezius. Use your opposite hand to gently knead and massage the muscle that runs from your neck to your shoulder. Apply firm but comfortable pressure. Remember to breathe deeply and relax. It's important to remember that pain isn't just a physical experience. There's a strong mind-body connection. Stress, anxiety, and depression can all amplify pain signals. When you're stressed, your muscles tend to tense up, which can worsen shoulder pain. That's why incorporating relaxation techniques into your routine is so important. Try deep breathing exercises. Inhale slowly and deeply through your nose, and exhale slowly through your mouth. Practice progressive muscle relaxation. Tense and then release different muscle groups in your body, starting with your toes and working your way up to your head. Meditation and mindfulness can also help you become more aware of your body and reduce stress. Even just spending a few minutes each day focusing on relaxation can make a big difference in your pain levels. Let's not forget about the power of nutrition. What you eat can significantly impact inflammation and tissue healing in your body. Incorporating anti-inflammatory foods into your diet can be beneficial for managing shoulder pain. Focus on foods rich in omega-3 fatty acids, such as fatty fish like salmon and tuna, as well as flax seeds and walnuts. These fats can help reduce inflammation. Other anti-inflammatory foods include fruits, vegetables, and whole grains. Avoid processed foods, sugary drinks, and excessive amounts of red meat, as these can contribute to inflammation. A balanced and nutritious diet can provide your body with the building blocks it needs to repair tissues and reduce pain. A key principle to remember throughout your recovery journey is gradual progression. Don't try to do too much too soon. Suddenly increasing your activity level or intensity can easily overload your shoulder and lead to a setback. Start slowly and gradually increase the duration, intensity, or frequency of your exercises and activities. For example, if you're starting a new strengthening program, begin with light resistance and fewer repetitions, and gradually increase the weight and repetitions as your shoulder gets stronger. Listen to your body carefully and pay attention to any pain signals. If you experience increased pain, swelling, or stiffness, back off and reduce your activity level. Patience and consistency are key to long-term success. Even with shoulder pain, it's vital to maintain an active lifestyle. Staying active helps prevent stiffness, promotes overall health, and can actually reduce pain in the long run. The key is to choose low-impact activities that don't put excessive stress on your shoulder. Walking is an excellent option, as it's gentle on your joints and provides cardiovascular benefits. Swimming is another great choice, as the buoyancy of the water supports your body and reduces stress on your shoulder. Cycling, yoga, and Tai Chi are also good options. Remember to listen to your body and avoid any activities that aggravate your pain. Consult with your doctor or a physical therapist to determine the best activities for you. So, there you have it, a comprehensive guide to easing shoulder pain without medication. We've covered everything from posture and exercise to nutrition and stress management. Remember, the key is to be proactive and consistent with these strategies. Don't expect overnight miracles, but with dedication, you can find significant relief and improve your shoulder health. Now, here's your call to action. Today, try just one simple stretch, perhaps the cross-body arm stretch, and notice how it feels. Make a conscious effort to improve your posture. Start small, be consistent, and listen to your body. You have the power to manage your shoulder pain naturally and reclaim a pain-free, active life. Good luck,